Scott just made the point.
Jefferson seems to be a lot more secure, not just in our Numbers aren't supposed to be scary. Numbers are cold. Numbers are calculated. The only people who really get excited about numbers are mathematicians and accountants, and how many great parties do they get invited to? And yet, I saw a few numbers Monday morning that scared me so badly I could barely sleep last night, and well, now it's my job to share them with you. I'm Steve Green, this is Trifecta, and with me, of course, your Trifecta stalwarts, Bill Whittle and Scott Ott. Gents, there was a Wall Street Journal report by Scott Atlas with just a scary number of scary numbers in it. The first one that stuck out at me was that due mostly to Medicaid expansion under Obamacare, between now and 2018, that's just 3 years away, the number of people receiving public health care will grow 3 times faster than the number of people with private insurance. That's from 107 million to 135 million people on Medicare or Medicaid. That's almost a 1/3 increase in the number of medical welfare cases. And then let's call it for what it is. It's welfare in a very short amount of time. But it gets worse. According to a 2014 Merritt Hawkins survey, 55% of doctors in major metropolitan areas refuse new Medicaid patients. More than half of those people are going to have almost nowhere to go. Bill, we're throwing more and more people into a system which provides less and less treatment. How many Pinocchios would you give to Obamacare's promise to expand and improve health care for America's working poor?
There's not that much wood in America, Steve. We just move on. We'll deforest the entire country. That's not going to get us anywhere. Look, you know, you're talking about how doctors are refusing treatment. I'm telling you, one of the things we're going to see, and sooner rather than later, is that there's going to be laws passed making doctors not be able to refuse Medicare patients. They're going to be forced to take them. If you can force Americans to buy health care, then you can force doctors to provide health care. It's all part of the same plan of liberation and the establishment of these basic human rights to people, and I guarantee you that's going to happen. And what's going to happen then, of course, is that these doctors are simply going to stop practicing, and that's essentially what everybody knows is going to happen. Anybody who has friends or relatives in the medical profession on the doctor end knows that being a doctor is just not worth the effort anymore. It used to be malpractice insurance, and now now you have to deal with all the malpractice insurance and 20 years of hard work and study, and $500,000 in educational debt, so that you can go out and work for less and less money, do more and more work for less and less money. And the one thing I hear constantly in doctors' offices, I hear this aloud from the staff. I'll hear them say this in front of patients. Can we just please practice a little medicine around here instead of filling out all these forms? Ugh. None of this matters, of course, to the elites that are ramming this down our throat. They're doing it in order to buy votes from people. And needless to say, the bottom line is, none of those people in Washington, like Barack Obama or Pelosi or Reid, are ever going to have to worry about waiting in line at a Blue Cross office where it's overstaffed by, subscribed, I guess I should say. 4 times as many patients as they can handle because the doctor has to process 4 times as many patients to keep his practice open.
Yeah, it adds up to more people with worse coverage, and no wonder emergency room visits are going up instead of down, like President Obama promised us. In just 3 years, more than 40% of all Americans will be receiving their health benefits courtesy of the American taxpayer. With an estimated 220 million taxpayers in 2018, that's only 1.6 taxpayers per recipient. Now, that's assuming that every taxpayer has their own private health insurance, which simply isn't true. Lots of working poor are on Medicaid, which puts an even bigger strain on middle-class American workers to make up the difference in the form of higher prices for every kind of care. And remember that each one of those working taxpayers is also on the hook for their own health insurance, plus any dependents like kids or a stay-at-home partner they might have. Scott, these are just numbers, but by the time you get to the bottom of them, every working American with their own insurance has to pay for almost an entire whole other person's health care. Isn't that a lot to ask?
But it's funny, we don't think about other things this way. I mean, if I suggested to you that, your car might need repairs, I think you should take that to the federal government. I think go down to the federal government shop, and my truck, for example, has a cracked windshield. So when I took it down to the federal government shop and let them know that it had a cracked windshield, I came back I think it was like 6 or 8 weeks later. It wasn't bad. And I came back to pick up my vehicle, and it turns out it had a brand new chrome tailpipe. They had taken care of that. They still had a cracked windshield, but they did get the chrome tailpipe because there were a surplus of tailpipes in the shop during this particular 2-month period, and so they decided to do that. I mean, people would never entrust almost any other element of their lives to government, and government has done this beautiful thing. They've come into a free market, and they've utterly destroyed it. They've created chaos and confusion and complication. And then they said, oh my goodness, look at the private insurance market. It's chaotic and confusing and complicated. Wouldn't it be better if the federal government was running this so that we could all be taken care of? You know, it's the old, you know, don't pee on my leg and then tell me it's raining. And I think at some point, it may take a catastrophic situation for people to come to this realization, but at some point people are going to say, whoa, 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 wait a minute.
I got the bill for your chrome tailpipe, by the way, and we need to have a talk about that.
That's right. Thank you.
And by the way, Scott, it
that.
is raining. It is raining. It's raining pee. Folks, the numbers get worse, if you can believe it.
Yes, it is.
It's everywhere. As fast,
the motto of the Obama
as fast as Medicaid... Sign of the times, folks. Get an umbrella. As fast as Medicaid is growing under Obamacare, 19 states haven't bought into the Medicaid expansion yet, including big ones like Texas and Florida, and plenty of medium-sized states like Georgia, Missouri, Virginia, Wisconsin, both Carolinas. You start bringing those on board, and it's just straw after straw on the backs of camel after camel, and middle-class Americans, have no doubt, are the camels bearing this load. Now, we've hardly gotten a raise in 7 years, but the demands on our paychecks keep going up and up. So it isn't whether you're for or against Obamacare, it's how much more weight working Americans can carry. And I don't know about you, but I'm starting to get tired of carrying this load. For Scott Ott and Bill Whittle, this is John Galt speaking.
Bet you do.